You've heard a lot of people talking about health informatics. But what is it exactly? In short, it is the way we manage mountains of information generated by health resources in the digital sphere. Okay, so what does that mean exactly? Let's take a look at what some students are doing in the Master of Health Informatics in one of the universities in the United States. Health informatics can touch all aspects of life. They can be helpful at home, where a smartphone app can keep track of almost everything in your fridge. If your groceries are about to expire, they can suggest a recipe so you can use those ingredients and they don't go to waste. They can also be valuable in communities, with meetup sites available, which allows people suffering from similar chronic illnesses to meet each other and get support. In situations, oftentimes these people are feeling neglected and misunderstood. They can also be powerful in combating diseases like gathering and tracking data movement of mosquitoes carrying Zika virus, for example. So the communities can focus on prevention instead of being unprepared for an illness outbreak. Health informatics applies information to help people live healthier lives. And in this video, we're going to discuss the importance of healthcare informatics and healthcare delivery system. There are different types of healthcare informatics that we are going to discuss in this video. We have nursing informatics, pharmacy informatics, clinical informatics, public health informatics, immunization informatics, biomedical informatics, and consumer health informatics, all with one goal: to provide a better outcome for both the healthcare provider and its clients.
Health informatics is the practice of acquiring, studying, and managing health data and applying medical concepts in conjunction with health information technology systems to help clinicians to provide better health care.
Healthcare informatics plays an important role in education and nursing work. Applying technology to knowledge may help identify potential problems earlier. Let's say, for example, with the use of electronic documentation, and identifying changes in patient status can occur quickly because the informatics are readily available.
One good example of this is the Welch-Allen's electronic vital documentation system that reduces documentation errors and simplifies the life of nurses. This revolutionary system interfaces medical record, saving minutes per patient while doing your routine vitals. You'll also be confident that you have documented vitals accurately to the correct patient record. Plus, you'll also have immediate access to patients' vitals. Now, how does this work? First, the nurse scans his or her barcode to enter an ID onto the device. Next, the nurse now scans the patient ID badge and then confirms his or her identity. Next, the nurse can now capture the vital signs of the patient, first by using a Sure BP technology that can acquire blood pressure in just 15 seconds. At the same time, the nurse can also take pulse rate and temperature. At any point of time, the nurse can also enter her manual measurements like pain and respiration, and at the same time, the nurse can also monitor oxygen saturation right at the bedside. On the home screen, the nurse can review the data, confirm the reading, and say with just a push of a button, the vitals are now sent to the patient's chart. Through the use of integrated wireless radio, the nurse can receive or will receive a confirmation message on the device, letting her know that the data has been sent. This system automates the documentation process, which provides clinicians the accurate information that they need when they need it.
Standardizing of nursing language with the help of healthcare informatics will facilitate acceptance of new methods of documentation in the electronic health record. A template of nursing notes is one method of assisting with our daily workload. The use of template cap remind you of important information required in the documentation of patient care.
One of the biggest complaints from patients and even healthcare providers is that healthcare is expensive and even wasteful at times. A lot of money is spent on repeat procedures when multiple doctors are seeing a patient and are unaware of procedures that have already been done. Some patients are unaware of what test they're receiving or why. They trust their doctor to make the right choices and do what they're asked. Lab tests are also done repeatedly by multiple doctors. With AHRs in a connected infrastructure, medical professionals can access the patient's medical records online and become instantly aware of what procedures the patient has had done, as well as any comments or diagnosis that may have been made for the patient. This can save thousands of money for the patient, the insurance company, and the healthcare providers.
Monitoring of patients' vital signs is always accessible and the data are interpreted, systematized, and arranged. The nurse is able to use this knowledge to formulate an appropriate plan of actions.
Quality monitoring can be improved through documentation of risks and incidents. A good example of this is the use of today's technology in order to prevent or reduce medication errors by entering an order using devices like computer tablet.
Technology-inspired mode of instructions can also be used by nursing educators for both the clients and also the nurses.
Personal computers can aid in the management like registration, recording student grades, and maintenance of course certificates. Information and communication technology progress provides the possibility of improving health through electronic education irrespective of time and place.
The most important way in which informatics is changing healthcare is to improve outcomes. Electronic medical records result in higher quality care and safer care as coordinated teams provide a better diagnosis and decrease the chances of errors.
Decision support systems like knowledge about cancer care or maintaining information and different research tools can be accessed by database management tools with the help of nursing informatics. Advantages of the automated database management systems. First, decreases the data redundancy. Second, increases the data consistency. And third, improves access to all the data. There are 4 functions of DBMS. First is to store the data. Second is to update records. Third is to provide easy retrieval of the data. And fourth is to permit records generation.
Pharmacy informatics is taking the healthcare informatics field to a new level by making the practice of prescribing and administering medication more precise. Drawing on medical knowledge and computer science, this field uses information technology solution to improve patient outcome.
As a science, biomedical informatics had been loosely practiced in the Philippines as early as the 1980s. Residents in tertiary care facilities who had access to IBM-compatible machines were already using word processors to store patient information. In other areas, anecdotal evidence of database management systems was used to store patient information.
Consumer health informatics is designed to empower consumers by putting health information into their hands, including information on their own health, such as diagnosis, lab results, personal risk factors, and prescribed drugs.
Public health informatics assures that the right technologies are used to improve the timely delivery of quality data and access data for a driven decision making. It builds bridges across public health work areas by translating these communities, creating opportunities for interoperable information pathways.
Multi-drug-resistant tuberculosis, or MDR-TB, is an important and growing problem in many developing countries. New strategies have been developed to combat the disease, but requires complex treatment regimens and close monitoring of the patient's bacteriology results. Web-based analysis have been developed to track drug sensitivity test results, patterns of sputum smear and culture results, and time to conversion from positive to negative culture.
Welcome to Public Health Ontario's OutTB Web, a secure internet application to extend tuberculosis surveillance. OutTB Web is designed to provide better information, knowledge, and support to help improve public health and safety. Once you've logged in, you will notice the map has loaded and there are several toolbar options to allow the user to maneuver around the map. There are a number of colored circles on the map representing genotype cases mapped to their address at time of illness. The purple are single cases, red are multiple, and as you zoom out, cases aggregate into large blue circles with the number of cases shown in the center. In addition to the main OutTB Web application page, there are several tabs that contain relevant information. These include frequently asked questions, an RSS feed with top TB headlines, as well as guidelines and information regarding the program. Focusing on the toolbar, you can see the options to zoom in and out of the map. The Pan and Identify tool allow users to click on the map to identify features, such as the health unit area. You can also return to the last location, clear features from a case search, or zoom out to the whole province. The Data Import tool is only available to the Public Health Ontario lab administrators. On the left, there is a panel for the newest cases in the past 90 days, allowing users to view all cases or just those clustered cases based on identical genotype matches. There are several other options available to the user in the side panel: a match finder, map layers, which allow the user to add contexting information to the map, as well as display options to limit the cases by date ranges. The IFAS client ID is the unique identifier used in OutTB Web and is used to search for genotype matches in the match finder.
Individual and aggregate drug requirements can also be monitored in real time. Multiple analyses can be linked together, and data can be graphed or downloaded to spreadsheets. Over 1,200 patients are currently in the system. We argue that such a web-based clinical and epidemiological management system is an important component for successful implementation of complex health interventions in resource-poor areas.
Immunization information system at the population level, an IIS provides aggregate data on vaccinations for use in surveillance and problem operations and in guiding public health actions with the goals of improving vaccination rates and vaccine preventable disease.
An immunization registry or immunization information system is a confidential, population-based, and computerized information system that attempts to collect vaccination data from all persons in a geographic area.
Now, how can you benefit from using IIS or Immunization Information System in your practice? The use of a fully functional IIS can reduce costs, streamlines practice workflow, and improve patient care. How? An IIS can facilitate workflow and help manage administrative costs by tracking inventory and distribution, supporting vaccine ordering, and other vaccine-related business processes.
Eliminate the need for and cost of coordinating point-to-point immunization record transfer between service providers.
Reduce data entry time and improve data accuracy and completeness with the ability to submit data electronically from the EHR to the IIS and import patients' immunization records from the IIS to the electronic chart.
Improve patient immunization rates and healthcare effectiveness data and information set scores which may be tied to pay for performance program.
Allow the patient's immunizations record, a core component for the pediatric medical history, to be truly portable and follow the patients regardless of service locations, generating accurate records for patients, schools, and childcare. Identify vulnerable patients during an outbreak of a vaccine's preventable infections.
Let's take a look at how IIS helped the healthcare delivery system in Albania. IIS is the online immunization information system that can record, chart immunizations, and manage vaccine stock. This new system is intended to provide the following benefits. Number 1, enable unvaccinated children to be found. Number 2, improve stock management. And number 3, reduce paperwork. Before the use of IIS, healthcare providers spent many hours planning their immunization sessions. Each month, nurses made a list of children that are due to be vaccinated by going through a paper-based immunization registries, one road at a time. There is no easy way to keep track of children who moved out of the district and vaccinated elsewhere. Each time a child is vaccinated, the nurse is required to record the vaccination in up to 7 different paper forms in registers. This paperwork reduces her time she would have given to her patients. And despite their hard work, some errors are still inevitable. Right now, with the use of IIS, community health workers can use this information to locate unvaccinated children. Young vaccinated children can also be quickly identified. IIS can also keep track of vaccine stock levels, supervise stock balances and wastage, and manage stock more effectively. Parents can also benefit from using their national ID number, where they can log in into the IIS and they can view and print the immunization record required for school enrollment. The use of IIS has provided a lot of benefits to the healthcare delivery system. Increased ability to find unvaccinated children. They provided a more timely vaccination. Provided a better understanding of non-vaccination by giving instructions and education to parents. Improved vaccine stock management. Increased ability to respond to adverse effects. And most of all, reduced paperwork.
By making all records related to patients' medical history and treatment electronic, clinical facilities are essential going digital. Healthcare informatics, when used properly, can improve safety of care outcomes, patient participation, and public health on a larger scale.
A better overall outcome is probably the most valuable reason why healthcare informatics is so important. It provides safer, cheaper, and higher quality care. And because coordinated healthcare teams all have the access with the same information, they are able to work more efficiently, make better diagnoses, and fewer errors.
It also eliminates a lot of manual jobs, which saves an additional amount of time in clinics, hospitals, and even for the patient. Healthcare informatics just provide a better overall outcome for everyone's involved.